Good afternoon, everybody. Thank you for joining us. Today we have a presentation, two presentations that talk about the needs and the changes of an aging workforce. First, we have Katy Terveer, who's the researcher, innovator with a mission to create better pathways for our health, social connections, and purpose across our lives. Katy has recently started as the grants manager for Senior Services of Southeastern Virginia, the largest area agency on aging in her state. And previously, she led research for AgeWave for over 8 years, serving as the senior vice president of research. AgeWave, if you're not familiar, is the nation's foremost thought leader dedicated to illuminating how aging, longevity, and retirement are reshaping the marketplace, the workplace, our communities, and our lives. And after Katy's presentation, we have Emily Beach from the Age Friendly Institute, and she will be talking about their Certified Age Friendly Employer Program. For those of you who are in New Jersey, we have NJAAW has a grant to bring New Jersey employers into this program with all costs covered. Emily will review that, and you can follow up with me after the meeting if you are interested in pursuing that. So, excuse me, we do have a lot to cover, so I'm going to turn this over to Katy. Go ahead.
Okay, great. And I'm going to start sharing my screen. Okay, make sure that it's in. Okay, can you see my screen? Okay, great. All right, so it's my pleasure to be here, and thank you all for joining us so that we can have this important conversation about how we can redesign work for longevity, supporting not only older workers, but also those who are working and caregiving to an older adult. And I really believe that this is a topic that impacts us all, if not right now, at some point in our future, hopefully. And so we really need to think about creating a better system of work as we're entering this new age of longevity so that we can continue working through all these different stages of life. So I'll just go through a quick introduction, then we'll focus a little bit about older workers and the huge kind of, I would say, missed opportunity there, how we could really be doing a better job of tapping into that population and the workforce. Then we'll talk specifically about those who are caregiving to older adults, which I think is really a matter of saving lives and kind of some of the turmoil that happens when you are a caregiver, and also is an economic issue. It really impacts our economy and it impacts our workplace. And then last, we'll spend a little bit of time talking about how we can become agents for change in the workforce. So just a little bit of background. I know Kathy gave a quick intro, so I won't repeat that. I will say I spent the past 8 years doing research for AgeWave, and so how this kind of came about was some work that we did for Harvard Business Review, and we wrote 2 different articles, one last year, one earlier this year. The first on redesigning retirement, and that was really around how companies can better tap into older adults in the workforce. So if you're looking for more information, feel free to check out those articles. If you're having trouble accessing those articles, because I know there can be a paywall, feel free to reach out to me. I think I have so many free articles that I'm able to send. And then the second one was Your Company Needs an Elder Care Policy. And so really trying to convince HR and business executives of why this is a topic that they really need to be considering, and kind of comparing it to the progress that we've seen around childcare support, and that this is as important as an issue as childcare. Okay, so first we'll start by talking about supporting older workers. Again, this is really kind of a huge missed opportunity. And one of the interviews that I really enjoyed was with Dr. Linda Freed, who's the dean of the Mailman School of Public Health, and she's a champion for aging with purpose. And what she said was, we have not built the roles and societal organizations that value and know how to deploy the assets of older age. And I think that a lot of times, particularly in the aging world, we can get so kind of hung up on what are all the needs and the challenges of an aging population. But there's this huge flip side of these assets of older age, and how can we allow older adults to continue to contribute in ways that work for them as they get older. So I like to kind of back up and put this in a little bit of historical comparison, because I think it becomes really helpful, especially as we're thinking about ageism and how ageism kind of has come into play. But if you think about the United States and kind of pre-1935, many people were living with their families on farms, and you pretty much worked until you couldn't. Your family would typically take care of you for that brief period of time where you were disabled. And they also had poorhouses, and so poorhouses became more filled up, especially during the Great Depression. And so the government saw a need to kind of step in, and that's when we created Social Security. So when Social Security started, 1935 to 1940, we chose 65 as that beneficiary age. And what's interesting about that 65 marker is that it's really gotten stamped into our culture as this kind of marker of old age, and also this notion of like, yeah, you should retire. Like that's kind of what has become expected. And so from the 1940s, to 2000, we've seen a huge rise in life expectancy, and the nature of work has changed dramatically. But many of kind of the norms around you retire and you spend, the last 20 years of your life in retirement have really kind of stuck a little bit. So if you kind of fast forward to today, we are seeing some changes. So this is just kind of like a look at then 2004 and now 2024. We're seeing that many adults are starting to work longer today. And that 65 to 74 age range, we had 22% staying in the workforce. Now it's up to 27. In terms of numbers, because this is really a growing population, we've seen more than a doubling from 4 million workers 65 to 74 all the way to 9.5 million. And even in that 75 plus category, we've seen a doubling from 1 million to 2 million. So I think that as we're living longer and there's a lot more diversity in terms of old age and what's our kind of capabilities as we age, there is more of a movement towards wanting to stay in the workforce, or for some, there's a lot of financial challenges and they have to stay in the workforce.
Excuse me, Katie, I just wanted to say to everyone, if you have questions as we're going through, you can put them in the chat. There will be plenty of time for questions afterwards, but if something comes up that you want Katie to address, please put it in the chat.
Thanks. Okay. And then looking kind of forward out over the next 10 years, we see in terms of the growth of the labor force and the size of the population, the largest growth is going to be in that 65 plus category. So older adults are really going to be driving the growth of the workforce. And so we need to think about how we can best utilize older adults in the workforce, because I think right now we're struggling from a limited imagination. And I think that you could potentially even see bigger numbers in terms of the growth if we could adapt work to be more suitable as we age. So this comes from a question that we asked in one of our studies. We asked people who are pre-retirees and retirees over the age of 50, in their ideal world, what is the ideal approach to work and leisure and retirement? So as you can kind of see on the left-hand side, the majority, 59%, would like to work in some way. And that's really a mix. For some, it's going to be working full-time. For other people, it might be working a part-time job. And then other people are kind of want to be able to flow in and out of the workforce. So to be able to, take a year off and then come back. And I think that's really important, is thinking about how we can help people to get back into the workforce. Okay, so one of the reasons I think it's really important for us to be thinking about how we support older workers is because the benefits expend far more than just financial. So retirees say that they're interested in working because it's going to keep them mentally active, physically active. It's going to provide a sense of purpose and social connections. And yes, it's going to provide them some additional financial stability too. So what is the benefit to employers? First of all, we see that as people get older, they tend to, on average, there's greater social and emotional intelligence, which makes these people good managers, customer service reps, and mentors as well. And then the next is that from all of these years of experience, there's high levels of expertise and crystallized knowledge, which is basically the knowledge that they've acquired over time. So if they're able to stay at their organization or in their industry, that knowledge that they've acquired is actually really valuable. Third, we see in some of our research that on average, again, older workers tend to be more loyal, they're more likely to stay with the company for longer, and they have higher levels of engagement. And then the last, I think this is really important, is thinking about age diversity and how offering those multiple different perspectives on a problem enables teams to outperform. So this is really adding to the productivity of the workforce. And then I think societally too, there's some really big benefits when we think collectively about how we can enable older adults to work longer. Clearly, we can boost GDP, we're increasing tax revenue, we're also making older adults have greater financial stability, so they're able to go out and spend more money and help our economy. Second, I think because of all that expertise and knowledge, that there's some real opportunity around enlisting older adults to solve some of our toughest challenges, whether that's climate change or rising healthcare costs. I think that there's a huge opportunity there. And then last, again, because of those tremendous benefits that we saw from working, we can reduce some of the costs from social isolation, chronic diseases, and financial insecurity. So in sum, to keep older adults in the workforce, we need to really think about the ageism that is holding a lot of older adults back from being able to stay or return to the workforce. And we also really need to reimagine the way we work and think more creatively about how, when, and where people can work. So I'm going to go into working caregivers now and the importance of supporting them. One of the interviews that we did was with a chief human resource officer at AbbVie, and he talked about how almost everyone will have caregiving responsibilities at some point in their professional life. When their family's needs are met, employees can perform at their best. And I think that's really important for organizations to understand. It's not just like there's a certain group of your workers that are caregivers, but caregiving is this really kind of fluid life stage that people can flow in and out of at any time. And so is the organization ready when that happens? So this is pretty eye-opening for a lot of people. I think they don't really understand just how big this group is. So on the right-hand side, we have caregivers to older adults who are in the workforce. Almost 24 million people are currently in the workforce and caregiving to an older adult. That's 14% of the population. It's even a little bit larger than the number of people in the workforce who have children that are kind of in that preschool age category. And this is something that I think is going to become increasingly prevalent in the workforce in the years to come. This is the care support ratio, which gives us just kind of an indicator of the number of kind of middle-aged people, which tend to be the largest group of caregivers to the age 80 plus, where we see the greatest need. And we see that shrinking from 5.5 in 2025 into the threes in 2035 and beyond. And so as families have gotten smaller, families have gotten more geographically diverse, this is going to become more and more prevalent in the workplace. And I think it's also important for us to understand that caregiving impacts us all. There's kind of a stereotypical image of a woman as a caregiver, but 45% are men. 46% are between ages 45 and 64. And so those are really those peak years of experience and productivity, a time when it would be great to be able to keep them in the workforce and to allow them to continue working and transferring that knowledge over. And last, not everyone is in that middle age category either. We have 20% that are part of the sandwich generation. So those would be people who are caring for a child under 18 and also caring for an aging parent. And so they're going to have different and probably more needs from their organization as they navigate taking care of both sides. One of the reasons why this is really kind of a family issue is that paid care is really unaffordable for most. So I pulled, these are numbers for New Jersey. The first is the household median income, which is $104,000 for 2024. And that's about, and then the average cost of home health aid is about 80% of that total median income. So it's not really affordable for a family to be able to full-time pay for care. A nursing home is even more. And then for people who are able to afford it, the availability is really an issue too. Just finding caregivers when we are facing workforce shortages.
Katie, do you have an idea of how New Jersey compares to other states? I'm assuming that we're probably more expensive because housing and everything else is more expensive in New Jersey.
Yes, I think it is more expensive. It would be interesting to look at it comparatively, like because your income is also higher.
Oh,
So
okay.
yeah, that would be interesting to look at though. And this is from a survey of working caregivers, some of the impacts that they faced at work. Half are going in late, leaving early, taking time off. Over a quarter are shifting or reducing their hours. Lots of other movement, turning down a promotion or moving to a different team, and 16% stopped work altogether, and 13% changed employers. So I think it's helping caregivers to navigate some of these trade-offs in a more proactive way so that it's not kind of retroactive and then they're not making a decision that leaves them financially worse off or making it more challenging to re-enter the workforce when they take time off. And I mentioned earlier that this is really an economic cost. Caregiving costs the economy $264 billion annually, and that's from lost employment, higher absenteeism, and compromised caregiver health. So we're already paying and kind of paying for this cost, basically, this opportunity cost. And so I think the question becomes, how do we think in a more proactive way so that we are able to support caregivers so that they can continue working and contributing in a way that works for them and isn't overly kind of stressful and compromising their health. This is a question that we had asked on one of our surveys about working caregivers. And 92% said yes, they wish that they had more support while they were caregiving, but the needs really varied. So there's not really one clear silver bullet solution. It's really having a lot of different options that specific caregiver might need. So for some, it might be just a matter of getting the resources, like having a source to find paid caregivers, or having an advisor who can help you navigate the medical system. For some, 32%, they just really needed that financial assistance to support them. Sorry?
Hello? Yes, who's?
Oh. And then for some, it's about greater workforce flexibility. And then for others, it's about training. So again, I think we have to think kind of comprehensively about what the needs might be and how the needs might change. So why should organizations care about supporting their working caregivers? First, again, it can kind of improve productivity, allow the caregiver to continue working and contributing so that they're not having to leave the workforce, and then we're not kind of losing them and losing all that knowledge. Second, this is really a recruitment and a benefit strategy. People want to work for companies that they know prioritize work-life balance and supporting families. Third, this is something that doesn't get talked about a lot, but there are strengths of caregiving. And so there was a study that was done that showed kind of the things that caregivers tend to be more resilient and also to have a lot more empathy. So there's kind of some gains that happen as you become a caregiver that actually can translate into the workforce. And then last, lowering the healthcare costs for the caregivers themselves, because it can take a physical, a mental, and an emotional toll as you're caregiving. Okay, and so now we'll talk quickly about kind of the role that we can play as we think about becoming agents for change in the workforce. So I think one of the things that's kind of helpful to think about is a new workforce infrastructure needed. And we can kind of think about on-ramps and off-ramps and alternate routes like a highway system. So by on-ramps, allowing people to re-enter the workforce. And I think this is key both for older adults and for caregivers. Sometimes you have to step out of the workforce or maybe just a change in employment, and it becomes really challenging to re-enter. One of the things that we've seen that's been kind of neat are the idea of returnships. So having an internship that's designated for people who have been out of the workforce for a year or more. Also thinking about off-ramps. So knowing that somebody is going to have to decrease their schedule, how can we, instead of a sudden stop, how can we kind of decrease their work slowly so that we're not losing all that knowledge when they walk away? And then lastly, alternate routes. So different ways of working, having that more flexible hybrid kind of working options that are going to work for people as their needs and availability changes. And I think it's important for us to think about change on multiple levels, both from the top down. So thinking at the macro policy level, I know that New Jersey is one of the states, I believe, that has some paid leave benefits. I think there's probably a lot of positive change that could happen at the top down level. There's also a lot of opportunity in the middle and at the bottom level. So in that meso level, thinking about organizations, also thinking regionally about what are the changes that we can make to better support these groups. And then at the micro level, just thinking personally and in our relationships, how we can push this issue along. So I'll just share a couple of examples. I won't talk about the macro level because that's not my subject matter expert. But I do think that is probably like a huge opportunity, is thinking about at the policy level, what do we need to be advocating for? So these are some of the things that showed up in our interviews, different policies and benefits and resources. First, that supported older workers. So seeing some phased retirement programs, kind of thinking about that slowed down off-ramp. Also thinking about new skills training. I think that older adults can get skipped over when we're thinking about new skills and training. And so I think we need to be more intentional about having that mid and later, kind of later career level skills training. Mentorships are a great use of older workers. And then I think that leveraging the multi-generational teams. So we talked about that age diversity benefit and also the training for managers so that they can think about how they can create those multi-generational teams. I'll go over to the caregiver side, and then I'll come back to what works for both. Family leave, especially if we can do paid family leave, even better. That is going to allow them to have that financial stability and then come back into the workforce too. We also saw in our interviews, a lot of the larger companies were creating caregiver resources that were really interesting. having access to an elder care locator, somebody who could give you vetted resources, or having access to an elder care attorney, having some training specific to caregivers. And I think a lot of them are partnering with companies that already do those things, like care.com and Bright Horizons. So I think having those partnerships that give employees some resources that they really need as caregivers. Mental health, any mental health resources are also going to really serve caregivers. And then last, backup care was something that the companies, some of the larger companies, were offering, so that, you know, people didn't have to leave work because their caregiver wasn't able to show up that day. And then there's a lot of things that support both. So I think having flexible work arrangements is really relevant to both groups. Having paid time off. We also talked about the returnship, that idea of how do you on-ramp back into the workforce. And then having anti-discrimination, hiring, and training practices so that people can be more conscious of these issues. So I just wanted to share one meso level example from where I am. And that is kind of, and I think in general, looking at what childcare groups have done, or what progress has been made related to childcare benefits, is really helpful when we're thinking about elder caregiving. So this is a group called -9 to 5. They focus on improving health for pregnancy all the way through ages 5. And so one of the groups that they created was this business leaders workforce group. So they basically have created a task force that is specifically thinking about employers and how do we support childcare for working parents. And they've partnered with some of our local universities here. They've also pulled in our top employers in the area. And so they have this big kind of stakeholder group that is collecting data and really looking at kind of a supply and demand lens of, you know, what is really needed, and how can they work collectively to create the resources and the capacity. One of the things they were doing was kind of using some seed funding to train at-home daycares. So really understanding what the capacity issues are and then investing in it and creating a strategic plan. So I think that there's just a lot of things that we can kind of look at and say, how do we apply this to elder caregiving, or how do we apply this to older adults in the workforce? And then again, at the micro personal level, I think it has to come from the bottom up as well as the top down. Participating in conversations like these, making sure that we're kind of getting outside of just the aging world, but really into the business world too, so that they can see this topic. Writing like a local op-ed would be a really good micro level example. Challenging the status quo, ageism and discrimination where you see it, calling it out. Sharing our stories of reimagining work. So if you are somebody who is an older adult and you're working in a different way than kind of is typical, sharing that, making that more common. Or if you're a manager, being more open to those different ways of work and supporting individuals as they are kind of navigating these new life stages. So in conclusion, we talked about how we have entered a new age of longevity in the workforce that is expected to grow. But these workplaces have not kept pace with the changing demographics. We are largely missing out on the enormous untapped potential of older workers. And the lack of support for working caregivers is costing us billions in lost productivity and healthcare costs. What we can do, we can redesign the workforce to better support both groups in a way that enhances productivity and well-being for all. And that change is really going to have to come from the macro, meso, and micro level. So I have a question for you now. What's one action that you would like to take to better support older workers and/or caregivers? And if you have any questions for me, feel free to reach out.
I'll jump in with the first one. And I think I think this has become easier since COVID, since there are so many more working remote options, but it's giving people the opportunity to work remote from home so that they can be backup, you know, backup caregiver, deal with an emergency, take someone to an appointment, just having that flexibility to work remotely from home when needed and not just, having to actually physically go in person. Has that do you think that has become easier because with COVID we all, so many of us started
Yeah.
working remote?
Yes, yes, and people yeah, organizations were forced to have to figure out how to get their employees to work remotely, and so there has been, I think, a growth in that. We saw a little bit of a pushback, with some companies really saying we need to get people back in the offices. But I mean, if you think about pre-pandemic, where we are today, there's much more flex and work from home, remote options.
Any other questions? Okay, Katie, I think you covered it all.
Great,
Um,
thank you.
Thank you very much. And this is being recorded. We are going to send it out to everybody along with the PDF of the slides. So now we're going to bring on Emily Beach from the Age Friendly Institute. And I think you'll see that a lot of Emily's work at the Age Friendly Institute and the Certified Age Friendly Employer Program aligns with everything that Katie said.
Definitely, definitely. So I'm going to go ahead and share my screen here. All right. Well, thank you both. Thank you, Katie, for that very insightful presentation, and Kathy for facilitating this great conversation. It's a topic very near and dear to our hearts at the Age Friendly Institute. And we'll talk a little bit about the CAFÉ program, which, it might not, the certification program that we'll go into might not solve all of the issues or the things that Katie has brought to the attention of our group here today, but it certainly provides support and resources to employers to try to get to that point where they're really, really supportive of that older workforce. So, we'll start by, I just want to touch on that what strikes me most about what we've heard here today is that the fact that we have this research, and we understand the business case and we've seen best practices from around the globe, but the question is no longer why should we redesign for work for longevity, but rather how do we actually do it? And that's exactly why I'm excited to share some very timely news with you today, because while research and inspiration are essential, employers need a clear roadmap and support system to transform these insights into action. And that's where the Certified Age-Friendly Employer Program comes in. The Certified Age-Friendly Employer Program, or CAFÉ, is the internationally recognized certification that provides employers with exactly a roadmap to supporting their older workforce. Established in 2006 by the Age-Friendly Institute, CAFÉ has certified hundreds of employers across all industries who are committed to attracting, retaining, and engaging workers age 50 and older. What makes CAFÉ so unique is that it's not just a certificate that you hang on the wall. It's a comprehensive framework that addresses the very key issues that Katie discussed today. Everything from flexible work arrangements and caregiving support to combating age bias in hiring, creating meaningful development opportunities for experienced workers. The certification process guides employers through evaluating and improving their practices across recruitment, workplace culture, flexible work options, employee development, and more. Employers who complete the certification aren't just saying that they value age diversity, they're proving it through concrete policies and practices. And again, as I mentioned, the certification might not solve the issues for you, but it does highlight and bring resources and support to employers looking to support their older workforce with resources like virtual workshops, white paper research, custom training, and support for programs for older workers. The list goes on. So here's something pretty exciting about the certification program that we're working on for the next couple months is that we have a grant partnership with the state of New Jersey. So the Age-Friendly Institute has partnered with New Jersey Advocates for Aging Well, Kathy's organization, on a groundbreaking grant-funded initiative to bring the CAFÉ program to the Garden State. This is one of the New Jersey Department of Human Services age-friendly project grants, and it represents a transformative opportunity for New Jersey employers. So over the next few months, we'll be recruiting and certifying 12 to 15 New Jersey employers as certified age-friendly employers for free for their first certification term of 2 years. Think of this as creating a pioneering cohort, a community of forward-thinking businesses who will become their models for age-inclusive employment practices in New Jersey. This directly supports recommendation number 8 in New Jersey's age-friendly blueprint, which calls for obtaining credentials like CAFÉ to signal workplace support for older employees. And it builds on a momentum from New Jersey's 2021 law eliminating mandatory retirement. So what this practically means is that you'll receive some expert guidance through the certification process, networking opportunities with other progressive employers in the cohort, recognition as a leader in age-inclusive employment, access to training and resources from the Age Friendly Institute, and the competitive advantage of tapping into highly experienced, loyal, and productive talent pools. So we are looking for diversity, employers from various industries and business sizes, whether you're in healthcare, finance, manufacturing, hospitality, retail, really any other sector, there's a place for you in this initiative. After everything we've heard today about the opportunity in front of us, the research, the business case, the global best practices, this is your chance to be at the forefront of this movement. With more than 2 million New Jersey residents over age 60 and at least 25% of them still working, we're not talking about a niche issue. We're talking about a critical workforce strategy that addresses the labor shortages you're experiencing right now. So I encourage you, don't let today's inspiration when you leave this room. We'll take action together. If you're interested in joining this groundbreaking cohort or want to learn more, you can please connect with me or Kathy. I have our emails listed here. Thank you for being here, and thank you to Katy and Kathy for helping us reimagine what's possible when we design work for longevity.
Thank you. So I want to open it up to questions for either Emily or Katy about the presentations or about the age-friendly employer certification. And if anybody is interested in pursuing that, I dropped my email in the chat. I'll also put that in the follow-up email with the recording. Questions, anybody? Okay. Okay, we have all right, I think you covered it all.
Well, thank you so much for having us.
Thank you for coming. We will, as I said, we will be sharing this recording with everybody and posting it on our website. I'm also going to put in the links to Katy's articles. And if you have a hard time reaching them through a firewall or a subscription, I'll put in Katy's email so you can reach out her directly for a copy. Thank you again for joining us.
I'm so sorry, Kathy. Can I ask a quick question? I couldn't get off mute.
Sure. Oh, go
Sorry.
ahead.
I wanted to ask about the opportunity. So can understanding you have to be an organization in New Jersey, but can you have a corporate office somewhere and then have a branch in New Jersey, or are you really looking for companies that are based right in New Jersey?
We can do both. So for a branch in New Jersey, and depends on the size and where you are, but also, and Emily can answer this, it is a national, actually an international program.
Okay.
So Emily, if you want to take that.
Yeah, we're predominantly with this partnership, we're looking for organizations headquartered in New Jersey. We can talk offline a little bit more detailed about your use case. The certification program is, like I said, global. So regardless of whether you meet the criteria for this grant, we would love to certify your organization through our rigorous process. So if that's something that you're interested in, just shoot me or Kathy or both of us an email, and we'll help you kind of figure out the best path forward.
Fantastic. Thank you so much.
Sure.
Thank you.
Thank you. And I joined late, so I'm happy to hear there's a recording that will be shared. So really appreciate that.
Sure.